With aging, it is common to have hip and knee wear and tear. But is it similar in sports? Let's find out. Hello fellow friends, I'm Erik Hohmann, Orthopedic Sports Surgeon working at Burjeel Hospital Dubai. Welcome to the Hip and Knee series. Join me as we cycle away to learning the 4 W's of sports injuries. We're going to talk about the ACL, or how we call it, Anterior Cruciate Ligament. The Anterior Cruciate Ligament is the ligament as shown in this little insert and crosses from the front of the knee to the back of the knee. It basically is a stabilizer to resist movement of the tibia. This is the tibia, this is the femur, against the front. So it's a stabilizer towards anterior tibial translation, how we call it. Now, how often do we see these injuries? We do not really have data from the UAE or the Middle East, but there's good data from the USA, and approximately 200,000 injuries per year occur in the US. This is equivalent to approximately 1 ACL tear in 3,500 patients. How do these injuries occur? Most commonly, they are a result of what we call a deceleration injury. This means you rapidly stop from running or rotate with a foot planted on the ground. It can also be caused by hyperextension movement. So you hyperextend your knee while performing certain activities. Now, what happens if we do nothing to the ACL? So what happens to what we call the natural history of an ACL tear? We're not 100% sure, but what we do know is that you are very susceptible to other injuries inside the knee. Within 5 years, you have an 80% chance of sustaining a meniscus injury. We're going to talk about the meniscus later in this series. If you have no meniscus tear, but an isolated ACL tear, we know that in approximately 10%, the knee will become osteoarthritic or worn out within 5 years. If you have a meniscus tear, there's a 100% chance that you have some sort of osteoarthritis within 5 years of the injury. What we also know from studies, if you follow them up over a long period of time, approximately 30 years, there's an 80% chance of a meniscus tear over the follow-up after 10 years. There's also a very high chance of damaging the articular cartilage of your knee within 15 years. The data suggests approximately 70% of patients who have an ACL tear do have cartilage injuries. 35 years after ACL injury, there's a 50% chance that patients require a knee replacement. So now what can we as sports orthopedic surgeons do to help you? The question really is, who needs surgery and who does not need surgery? There are some general rules. You do not need surgery if only you have a partial tear and feel no instability. If you have a complete tear of the ACL but perform low demand sports and the knee feels stable, you do not require surgery. If you're willing to give up your high demand sports, you do not require surgery. If you only do light work or have a sedentary lifestyle, you most likely do not require surgery. These are the current guidelines of the American Academy of Orthopedic Surgeons. So who does need surgery? Someone who is involved with active sports, manual workers who require pivoting or turning of the leg, heavy manual workers, significant instability, and if you have a meniscus tear that can be repaired, the ACL should be repaired. How do we do that? The ACL does not heal by itself, so we need to reconstruct the ACL using other tissue. Most commonly, we use what we call the hamstring tendons, as you can see up in this picture. The treatment or the surgery is normally arthroscopic assisted, and the hamstring tendon then replaces the ACL. There's something new on the horizon, which means primary repair of the anterior cruciate ligament. Primary repair can be done in the very early stages, but only for very specific tears. As you can see up there, we now divide the tears into 4 different type patterns. If you have a type 1 or type 2 tear, which is very close to the femur, then repair is a worthwhile. On the horizon nowadays is what we call primary repair. primary repair can be performed in very specific scenarios. As you can see up there, we divide the tears into type 1 to type 4 tears. The type 1 and type 2 tears are very close to the femur, and these tears may be worthwhile repair if it's been done very early in the process. Now, it's not all good news. How many of us can return to sports after ACL reconstruction? The data is fairly clear. Only 2/3 can return to the same level of sports, and 41% return to somehow lower levels of sport. Thank you for watching the Knee and Hip series. I hope you learned a thing or two. We welcome you to make a comment or suggestions in the box below. And if you like this episode, please hit the like button. I'm looking forward to seeing you again at the next episode of Knee and Hip series. Cycle away.